Okay, let me just read it out loud.
Whatever reaction you have, just let that be your reaction.
People really said this?
I'm just gonna try to be PC.
Shannon said it would be nice to see something other than COVID crap. It's getting old. I agree with Shannon. I wish we no longer had COVID crap.
Dave. Oh, Dave.
Cody, COVID-19 should be renamed the Common Core virus because the numbers aren't adding up.
So this is our culture, right? So Michael says, this is a good one, Michael, if you're crying about bars not being open, you have bigger problems than COVID-19. Y'all some fools. Christy says, come on. So if this is true, prove it. All the numbers are fake.
Come spend 12 hours in my ER. You'll see how real it is.
Yeah, I don't know how to answer that. It has everything to do with, it's a virus and it's a pandemic. It's kind of one of the worst case scenarios that we study about or we read about and prepare for.
Christine, I think the CDC updates their numbers daily. This is going to be the most accurate side if you feel like the news or other media outlets are incorrect.
Angela said, don't trust the Department of Health. Wow, that's a big one.
Jack says masks have been proven not to help. Stop being sheep. Wow, Jack.
This has been debated and proved over and over again.
Masking when you are in public and washing your hands and socially distancing is the key to make sure that you don't come into the hospital.
It's not like questionable, it's not indifferent, it's definite benefit, okay? In some countries, I mean, they have, in a couple of months, they knocked this really completely out.
Denise says, run, hide. The media will fill you with endless fear if you let them.
It's not fear, people. Fear, I think fear is not knowing what's going on. Putting your head in the sand and just saying it doesn't exist, it's not a good answer.
We've been taking care of this community for years. So why don't you trust us?
Connie says, I can't believe we shut down a $22 trillion economy for such a low death rate.
Ashley says, it's a 99% recovery rate. Please stop with the drama.
It's not drama, it's a pandemic. You might think the 1% of the death rate is low.
That small 1% is still a large number when you look at the actual number of people who have been tested positive.
People may think, oh, just one person died. No, this person had family, this person had friends.
Just got real personal. And I wish they were all still here.
Everyone's just feeling a little helpless and overwhelmed. The nurses are tired, the doctors are tired, the respiratory therapists are tired, and they very much feel the strain.
Our local hospitals, our local regional hospitals are all on ICU diversion. That means that there's no ICU beds at the moment.
It's not just COVID patients in the hospital. There's people who are still having heart attacks. There are cancer patients who still need treatment. I wake up every day wishing that all of this was a dream and that we could just go back to the way things were.
So Tori, this is a good one. You could be Jesus and the people from Louisiana still won't listen. Chat.
Tori, you might be right.
You have to be able to know what's going on. You have to be able to determine what battle you're going to fight. You're going to choose to help us curtail that virus, or are you just going to say, okay, I'm not going to worry about it.
In order to do the things we love in our culture, in order to have football games and festivals and school, we need to do our part. And our part in the grand scheme of things is very small.
By putting on the mask, by doing the hand washing, by doing the social distancing, you are going to try to hopefully save lives.
We're asking you to do this to help our community, and our community always comes together.
So do your part. Wear your mask.